I'll keep it brief, I think, for everybody. Hello, I'm Lauren. If we haven't met, I think I've met a lot of you, but maybe not every single face in this room. It's lovely to see you all out here tonight. I've really enjoyed myself so far. I hope you all have too. I'm going to talk a little narrower, a little bit more niche. I'd like to talk about pancreatic cancer. It doesn't get a lot of airtime. I specifically would like to talk about locally advanced pancreatic cancer, and the reason why goes back a couple of years. There was a professional relationship that commenced with an oncologist who specialised in upper GI cancers. So pancreatic cancer is a really common example of an upper GI cancer, and he was really passionate about making sure that his patients, my clients, exercised throughout their treatment. And then we sort of captured some data looking at how did these people go, and then looked at the data for the standard of care and made some comparisons, and there was some interesting things that came out of it, and I'll show you that at the end. But just some brief stats for you, and also an image of where the pancreas is, because I think I wouldn't have known before I did this job, somewhere sort of in and around your stomach. The stats for pancreatic cancer, there's not that many people that are diagnosed per year as far as cancer goes. It makes up less than 3% of new diagnoses every year, so it's fairly low. But unfortunately, the diagnosis is not a particularly good one. The survival rate is low, but it is getting better. Things are changing. Yeah, so there's lots of different risk factors for different types of cancer, and some of them cross with lots of different cancers, right? But in particular for pancreatic cancer, we see that things like obesity, lack of exercise, and long-standing diabetes seem to be a risk factor. And obviously, as exercise physiologists, it makes a heck of a lot of sense that we can have an influence over these things. Some of them are also habitual, and some of them are things we can't change. Family history, genetics, which we're learning a little bit more about. But the other interesting one is increasing age, and I guess, like a lot of things, the risk increases as we get older, but I also think about the fact that Australia and a lot of other countries, the population that is older is increasing. So I think that we will need more support for these types of conditions, for these diagnoses, and a better understanding of how exercise can improve the quality of life for these people, and indeed other supportive care, of course. For locally advanced pancreatic cancer, so it's contained, but only just, and they're the particular people that I looked at with my very casual study, if I can call it that. The usual pathway was chemotherapy, maybe chemo and radiation, and that was it. That was kind of the end of the story. Things have changed in the last few years, and now what's offered is chemotherapy, a scan to have a look at the status of things, an operation if things are looking pretty good, and then chemotherapy again, usually the same unless you had really poor tolerance, and then you might be monitored after that. You might be able to sort of stop treatment and kind of get on with your life, which was really exciting. And so this particular oncologist wanted me to be part of this process, because as you can imagine, 6 cycles, 12 weeks of chemotherapy, a few weeks to get past that, a massive operation, more chemo again, a huge undertaking for the body, right? So the fitter and healthier someone is all the way through, likely their outcomes are going to be better. That's a theory anyway, right? So there were some studies done, but there's not a whole lot. This one looked at people who had surgery, no chemo, looked at them about 95 days after, and tested their aerobic fitness and their isometric strength. And they saw that their strength and their aerobic fitness was much lower. And these people had just had surgery. We're not talking chemo, bookending the thing. So that was significant. And 95 days after, so 3 months had passed since the surgery, and still people were feeling the effects. There was a study in 2019 that actually gave people exercise prescription during their chemotherapy, which was really exciting. They suggested aerobic exercise, resistance exercise. They gave people equipment, phone calls, and they did it at home to see, is it possible, could people do this? And they did. They did an awesome job. They did really, really well. Did a whole lot of aerobic exercise, a little bit less resistance, but overall, they did a really fab job. Then there was a systematic review in 2021, And so tried to collate all the data together, see if we could come up with some unified ideas about how exercise might improve the function, quality of life, and everything else for these folks. And 300 participants were part of all of those studies. And what unfortunately happens a lot of the time when you try to collate all the data, and there isn't a whole lot of data to collate, they can't come up with any really strong conclusions. But they definitely showed that exercise looks to be something that helps with fatigue, quality of life, and impaired physical function, which we see across a lot of other conditions. Makes a lot of sense. They couldn't make any kinds of assumptions about how long should you exercise for, what type, and all of those sorts of things. So of course for these folks, we defer to the more general guidelines and then make specific assessment of the person that's in front of us. So in terms of people with locally advanced pancreatic cancer, so the group that I was particularly looking at, no studies that look at whether exercise has any influence on whether you can be a candidate for surgery, so whether it sort of leans you in one way or the other, and whether it has any effect on survival. So there's nothing like that. I captured the data of a group of 11 of the oncologist patients, my clients, who all had chemotherapy. There was an intent for them to have surgery after that chemo, so my job was to get them ready. And in terms of outcomes, the folks who I saw that I exercised with, 73% of them made it to their surgery as planned, and 73% of them were still alive at 1 year. I didn't look past that because the project and the data I had was only for 2 or just under 2 years. There was a couple of instances where surgery was abandoned, and there was one where chemotherapy created a complete response in the person. He didn't need anything else. He didn't need surgery, which was just kind of amazing. I think we all were a bit stunned. But this is not particularly useful comparable data. We can't hang our hats on this, but I think it gives me quite optimism for the lesser studied cancers, for the less understood and early stages of these things that, you know, we have lots of data for breast and prostate and colorectal cancers, and we know a whole lot about how exercise influences them. But, you know, bringing up the back of the pack, we have these less common cancers with these really exciting outcomes. Yeah. So thank you.